My name is Kristin Nichol, and I am Deputy Chief of Staff here at the Minneapolis VA Medical Center. This is the time of year when we start thinking about influenza, and especially about how to prevent influenza. Well, why influenza? I get lots of questions. Why so much attention to influenza? Well, influenza is a really nasty and miserable illness. It is an upper respiratory illness, but it's not your common cold. Typical influenza includes not only the respiratory symptoms, sore throat and cough, but often the sudden onset of fever, headache, muscle aches, and joint aches. It can leave a person feeling just absolutely miserable. In fact, many people will describe influenza as feeling like you've just been hit by a train or by a truck. Well, people who are unfortunate enough to get influenza, and that can be 5 to 10% of the U.S. population every year, will spend 4 to 5 days or more being ill. They might be in bed for 2 days. About 1/4 of them will even have to see a healthcare provider because they're feeling so ill. So influenza is a miserable illness. But it's also the complications of influenza that we particularly are concerned about as healthcare workers. For example, the complications of influenza can include pneumonia, exacerbations of chronic underlying medical conditions such as diabetes, lung disease, or heart disease. And these complications can result in hospitalization and even death. Well, who's at particularly high risk for developing these serious complications? Remember, everybody is at risk for developing influenza, but who is at especially high risk for developing those complications? Well, it includes babies and other young children. It includes people of all ages who have chronic underlying medical conditions, including, as I mentioned before, diabetes, heart disease, lung disease, other serious medical conditions. It includes the elderly, people 65 and older. It includes pregnant women. It includes people who live in nursing homes and other long-term care facilities. So there are lots of people who are at high risk for these serious complications of influenza. Well, what about preventing influenza? Well, your annual influenza vaccination is the best way to prevent influenza. And these annual vaccinations, usually a flu shot, are very safe and they are effective. They're not perfect, but they are effective in reducing illness and reducing the complications. So who should get a flu shot? Well, the U.S. Centers for Disease Control and Prevention and the VA recommend that all adults get a flu shot or an annual influenza vaccination every year. Now, healthcare workers are in a special category. We all have a duty to first do no harm. And why do I say that when we think about influenza? It's because healthcare workers can develop influenza, of course, and if they come to work while they are still contagious, they can transmit influenza to their patients. And patients who have developed influenza from healthcare workers may be very ill already. And there have been reports in the medical literature of patients becoming ill, having prolonged hospitalizations, and even dying from the influenza that they got from a healthcare worker. We have a duty to first do no harm, to protect our patients, and that's why healthcare workers most certainly should get their influenza vaccination every year. So influenza is a bad disease. We should all do everything we can to prevent influenza, and that includes getting vaccinated every year. It will protect you, it'll protect your family and those you care about, and it will also protect our veterans.